Hi, welcome to the Health Bridge. I'm Dr. Tammy here with my great co-host, Dr. Pedram and Dr. Catherine. We are going to not only talk about IV nutrient, IV therapies, but we're going to get one. So welcome.
Thank you.
Let's talk about the benefits of this. I love these because I have an IV room in my clinic and we do them all the time. Great for travel, great for, I think this is the best flu shot ever. Like to boost your immune system instead of trying to go into a war. So I'm so excited to hear and learn what you have to share with us about this great stuff.
Thank you. I'm so happy to be here. So what we've got today, we've got 2 bags ready for you guys to go.
What's in it?
We've got a whole slew of, I call it liquid gold. It's kind of goldish. We've got magnesium, zinc, selenium, B complex, B12, B5, B6, trace minerals, calcium, vitamin C, of course. And I have a little surprise for later.
Surprise! So many people are nutrient deficient. So many people are not feeling well and can't seem to get over it. What's the promise of IV nutrient therapy?
The promise of IV nutrient therapy is that you are getting it straight into the vein, mainline it right into the system, 100% absorption. So when we eat something, whether it's food, whether it's a supplement, there's minimal absorption, and that absorption is even less if you have any sort of GI issue going on. And who doesn't have GI issues today, whether it's gas, bloating, anything. So what we see with this is that people can get nutrients in faster, in higher amounts, and much more effectively, efficiently, and without any sort of GI disturbance that may come from, eating too much vitamin C, and then you have to be in the bathroom all day. So we want to avoid that. So we get to really ramp up your immune system, decrease inflammation, replete all of your deficiencies, and that allows your body to really heal.
So how many times do people do this, and over what time frame? Do they feel different after one? Do they have to get 6 before they feel it? What should we expect?
So everyone's an individual. So I don't know exactly how you'll respond. But what I like to do with my patients, some people have amazing results after one. Like I've seen migraines gone in 20 minutes. If it's a nutrient deficiency and we're addressing the issue, that's very possible. If we have someone who's got a long-standing chronic illness, a lot of inflammation, a lot of complex systems involved, it may take twice a week for 8, 10, 12 weeks before they really feel better. Most people feel something after one. And most people start feeling a bigger boost after about 2 weeks, maybe 2. So I would say like six IVs, people should definitely be noticing something. Well, that's not true. Everybody's different. But what I commonly see is that by 6 IVs, we're noticing some serious improvement.
Yay, can't wait.
Yeah, I've had one here and there, like back in the day, like you go out and have late night, take one and helps, right?
Yeah.
But to actually kind of move your health forward and get into a position where your body is kind of built up some more resilience, my experience has been, it's been half a dozen or so, and then all of a sudden it's just like, hey, there's a new normal now. Like the body isn't robbing Peter to pay Paul, but it's like it's got enough to then kind of move forward. So
absolutely, because our nutrient deficiencies are exacerbated over time if they're not identified and addressed. So it may take that series to just get you back up to minimum, where the body can actually just start the normal functions again, and then you need that extra to keep healing. So if you've depleted your stores, it's we gotta hit it hard.
Yeah, and I think I have not met a person in the modern world who hasn't depleted their stores to a certain extent, because topsoil is devoid of life, therefore nutrients that can come in, and we have all these things that rob us of our nutrients and our minerals. And so I'm assuming you see that in pretty much everybody.
Oh, absolutely. Absolutely. And what I like to do with my patients is run a very specific test to look at every single vitamin, nutrient. It checks amino acids. So we can look at exactly in your body what you're deficient in and customize your plan for you. I do have patients who kind of get like a general bag, like what you might call a Myers cocktail, or there's all sorts of fun names out there. And that can be that's very effective as well. What I find most effective though is when we really customize it to the patient. So there's testing for that, because who knows whether it's a genetic thing in you or whether it's what you've been eating or not been eating, and that's really the best way to know. And then we can retest afterwards, and you can see, okay, this is where I was, this was how I was feeling. We did the series of IVs, we addressed other underlying issues that were depleting you or everything else that was going on. And then at the end, here's how I feel, here's what my lab results say, and you can actually track progress both objectively and subjectively. So.
Great.
Cool.
Yeah, and colds, flus, virus. Like
oh my goodness, this is like Dr. Tammy said, this is like the magic bullet.
Yeah.
So I would typically we do extra vitamin C. We'd want to do it at the first sign of illness, and then also lots of rest, lots of water, and we can really ramp it up to where you might start to feel like you're getting sick, but it doesn't last nearly as long. Your body is able to recover quicker, better, and you might even feel better than before you got sick.
Great.
Yeah.
So
Superman.
Yeah, no kidding, huh?
Faster.
Yes.
So how about we do the rest of the show while doing this and talking about it?
Let's do
because
it.
we might as well. It takes about 20 minutes to run this thing, and I know a lot of our viewers have never seen such apparatus, and so let's get into it. And just tell us what you're doing, and we'll go.
Absolutely. You're not going to pass out on me now, right?
I'll try my best.
Okay. Hold them up. Beautiful.
It's the men who normally do, right?
Oh,
It
yeah.
really is.
Yeah.
It really is.
I know.
I gotta say, it's I was there for the birth of both my children, and on the second child, I had a moment where I was like, "Oh, this is the part where the guys fall."
Really?
I took a little step back and was like, "Okay, breathe."
Wow.
Yeah.
Wow. Beautiful. Can I have an arm, please?
Yeah, you can have this one, wherever you want it.
Just hold back. There you go.
Bam! All right. So what we're doing now is
I'm putting on the tourniquet, so we're getting the veins nice and engorged, so it makes it easier for that needle to slide right in. Then I'm going to identify which vein I want to use. His are looking a little wimpy today, but I think we can handle it.
Yeah. It's not easy being me.
Okay, and then I'm going to
Sleep deprivation.
Sleep deprived new dad.
get in. Just hold a fist for me.
You put a little sleep in that bag? That'd be amazing.
Good. So now we're just getting all the bacteria out of the area.
It's kind of fun.
I love that, the vitamin C. So, I have a practice that's got, some people come to us for health and hormones and gut and adrenals and all that, but some people come to us for a natural way to look better because we have lasers and all that kind of stuff too. And vitamin C is required in about 5 places in the production of collagen. So you're gonna look good too.
Yay!
Good. Give me 5 big pumps. And then hold that fist nice and tight.
All right.
Good. And breathe. Nice deep breath in.
You're crazy. You
And
look
out.
I'm an acupuncturist.
Breathe. And out. Beautiful.
Boom.
So I'm going to tape you down right here.
Cool. My wife's a dentist, and she does these big needles in people's faces all the time, and she's deathly afraid of needles.
Oh, it's like nurses, right?
Yeah,
They're just
totally.
not happy people about getting a needle.
Getting their own needles, right, exactly. And so, as an acupuncturist, there it is.
There it is. So that's how we know we're definitely in the vein. Everything's looking good.
That
Don't
is my
look at-
blood.
And then we start the drip. So I can see how fast he's flowing.
You're flying.
Oh, God.
Well, I know we've got a timeline on the show today.
Why are my
Start with
eyes
the big
sticking
vein
out? Yeah,
first.
totally.
Oh, honey, you're gonna have.
I'm getting waxed
He's
today,
getting
too.
waxed,
I'm getting
too.
double duty here. They're gonna clear the fur from this creature.
No extra
Good. So you can just relax this arm.
All
Just
right.
hang out while you drip.
All right. And one of the most interesting things that, for someone who's never done this before to experience, is you start tasting the vitamins a little bit.
Yeah.
It's usually the B vitamins.
Those are the bees.
Yeah, so it's like, as you can tell, I haven't drank anything of this, and you start to get the flavor in your mouth, which is interesting.
It tastes like a bad Flintstone vitamin.
Ew.
Yeah.
Oh
Yeah.
But
Well, it's not that bad.
Yeah,
Actually, I've had these before, but when you're the doctor that owns the clinic, it's hard.
you never
I'm
do it.
given these every day, nearly.
Totally.
But I
It's
don't
like it's like the
receive them.
firehouse catching fire. I'm all crossed up here, so I'll sit like this. This is kind of fun. Hi, partner.
How you doing?
Yeah,
Had a
totally.
nice little IV bar today.
Yeah. So How much volume is in that bag? Because a lot of people are like chronically dehydrated as well, right?
Right. So we start with 250 milliliters or cc's of fluid, and we use half normal saline because that's what's giving us like the right amount, the right concentrations, osmolarity, yep, for the blood after I add all the ingredients. And then I add about 25 cc's of the fun stuff. The fun stuff.
Great. So if you're dehydrated, this also just kind of helps kick things up.
Yep.
Yeah, good veins there, sister.
When I was in medical school and we had to pass the test for drawing blood, everybody's like, "Can I use you?"
Oh, Tammy.
The veins that plus I'm see-through.
Plus you're see-through, yeah, it's true.
It makes it easier.
Yeah. No kidding, huh? Oh, it's fun. So I love getting IV therapy. It's just one of those things that's like, it's a luxury.
Just a little bit this way. It definitely is. And it's also, for some people, totally a necessity.
Sure.
Like, there are some patients I've seen who I don't know if they would have gotten well if we weren't able to get nutrients into them because they weren't going in any other way.
Yep.
Good. So nice breath in and out.
I don't look.
You don't
Nice breath in and out.
Breathe in.
And out. Beautiful.
That's the difference. Like, I do so much needle craft.
Oh, so do I.
Yeah. You just can't see it in yourself. Yeah.
Well, I probably could, but
You're not going to risk it.
on camera.
Right, totally. I want the clip of Dr. Tammy going backwards.
I know, I almost fell off the chair earlier.
I know. That was just at rest.
And just hanging out.
Nice work. 2 for 2. Clean.
Beautiful.
Yeah.
Sweet.
Yep.
Doesn't always work as well.
Not for everyone. Sometimes it takes a try, but
you're one of the best I've ever seen at it.
thank you.
Yeah.
I'm a vein whisperer, that's for sure.
Vein whisperer.
Nice.
Yes.
Oh yeah.
So I heard a rumor that the more deficient you are, the more you taste it, and I'm not tasting it at all.
Just wait. Just wait, tough guy.
Do you guys want to race? Just kidding.
No,
Just kidding.
it's not fair. Look at his size.
Yeah, look at that.
I'm just kidding. We're doing everything by the book, super safe today.
Okay, just today. Just today. So, a lot of the
And
things
this doesn't hurt.
doesn't hurt at all.
Yeah,
At
like,
all.
you can tell
Like
we're
it didn't
just
even hurt.
hanging
It didn't even
here.
hurt on insertion. Like it's
They're
just we're
little
hanging
needles.
out. Yeah. So it's kind of fun. And so when somebody is behind the kind of the health ball, right, and is just having a hard time catching up, the GI, we've talked about this on multiple shows, most people just have terrible absorption. Their guts just don't work the way they do. So delivering nutrients through the mouth just doesn't get to where it needs to be, right?
Correct.
Well, and I have a lot of patients who say, but I eat really well. And I say, that does not prove you're absorbing it.
Totally.
Absolutely. Yeah. Not only do you have to get it in, but you have to get it in, and then get it out. But that's another show too.
Yeah. Totally. Totally.
Okay, so is this where I become a liar and say, oh, I taste it too?
Yeah. You don't taste it at all?
I do.
Yeah. See?
Oh, I knew
Exactly.
I would.
There's this
I was
time.
just trying to.
Just be grateful you
time.
don't have to taste the glutathione because that's
It's
not
gross.
a good one. Yeah.
It's gross. I've had oral glutathione. Yeah. So what does glutathione do?
I call it the super antioxidant in the body. So it recharges other antioxidants, very anti-inflammatory, supports detox pathways in the liver, increases white blood cells throughout the whole body.
Anti-cancer.
Anti-cancer. I mean, it's made in every cell of the body and even more so in the liver cells. And it's just really miraculous for a lot of conditions, and everybody makes it and everybody could probably use more of it.
That's interesting. We have seen it used more and more now in clinical settings. And so you have to push it separately though.
Yeah.
Yeah.
Yeah. Do you guys want your surprises?
Is that what we're doing? Oh, look at this.
So are you putting it in there at the end or just push through?
We're going to put it into the line so that it goes right into your body and doesn't have that much opportunity to mix or react with other ingredients. So you're getting the maximum value from your glutathione.
It doesn't
Great.
play well with others.
Not really, no. And it recharges other antioxidants. So it's not just having its own effect in the body, but it's recharging other pathways as well. So we really want it. we want to use every little ounce, micromilliliter, whatever of glutathione action that we can for our
Okay,
bodies.
so you're gonna push it. We're not like I'm not taking that in the arm.
That big needle is not going into your body, unless you're mean to me. But
Yeah.
you know, so we just get the air out.
Oh man, you're going faster than me.
Well, I have a 2-month-old at home. Surprised I don't look like a raisin.
Good. So we've got the port on the side. It goes right in there.
Bam.
I'm just going to stop the line. So this can feel a little different. So just let me know if it's uncomfortable at all, and I'll go super, super slow. But we're just going to push it a little bit at a time. And it's going right into the line, right into the vein, and then doing miraculous things all over your body.
What?
This is really more liquid gold. Or what's better than gold? Platinum?
Platinum?
Okay, so this
Yeah.
will be liquid platinum. That's liquid gold.
Yeah. Yeah, I was gonna say what's better than gold right now is sleep, liquid sleep.
Okay.
Well,
Can you pump about 8 more hours into this?
there's some great studies about aerosolized glutathione for lung conditions.
Absolutely.
And so it is magic, and it's used in all kinds of forms. But I haven't seen a lot of studies about it passing through the GI tract all that well, intact.
Agreed. Agreed. And there's a lot of controversy over, again, absorption. It's one of those that's like less than 20%, if that. And what theoretically I think is happening is that because our guts are so messed up, that the glutathione is being used in the gut right there. So the rest of the body doesn't even get a chance at it.
Makes sense. Let's go where there's trouble. Okay, we can't go any further.
Absolutely.
Got it.
First few cells you see, and it's like, oh no, so let's get to action. So that's why intravenously is really the best way to do glutathione.
What kind of patient populations can stand to benefit from this, like, kind of the most, like, readily?
Chronic inflammatory conditions, if you know you have a genetic predisposition, or what we call a SNP, where your body isn't able to make glutathione on your own, we definitely need that. If you know you have a deficiency, let me just find my little...
Cap?
Yeah. So I'm not waving needles around here.
Boom.
Thank you.
See?
So I'm just going to go right here.
Most helpful patient you've had all day. Probably not.
Well,
No.
you know. We actually have seen some really beautiful studies in Parkinson's patients with glutathione. Yeah.
Just brain inflammation? What?
I don't know if we even know a mechanism of action, but with a sequence over a series of days, that first week of treatment, they've seen some improvement in motor skills.
The studies were done at Bastyr, and it was a really big, beautiful, amazingly double-blind, placebo-controlled, scrumptious
Wow, right on.
trial right up at Bastyr, and it was intranasal.
Really?
Yeah.
So Bastyr, for those of you who don't know what we're talking about, is kind of the primo, it's like the Harvard of natural medicine, kind of naturopathic school up in Seattle area.
And
right?
they now have a
And
campus
San Diego.
in San Diego.
Yeah.
Yeah, they're really, really wonderful.
Oh, so you just bite the line this way. Got it.
Yeah.
Got it. Booyah. This feels
How you
good.
doing?
Yeah, I feel good. This is
Cool.
fun. See, 20 minutes we're going to pass either way.
We might not get done in our time, but at least people can see what this is, and then it's
Yeah, it's,
really no big deal. We're sitting here chit-chatting.
Totally.
It doesn't hurt.
Absolutely, yeah.
And it doesn't take long. I think the more dehydrated you are, the quicker it
just
goes
sucks in,
after you get the needle in,
Well, yeah.
Yeah.
because it just sucks.
That can be
Yeah.
a challenge.
Yeah, yeah. So yeah, go and get a big glass of water before you get an IV.
Absolutely.
Help your doc out.
I may make you do a few jumping jacks too if you're in that sort of if you need it. Yeah, handstands. How's that feeling, Dr. Tammy?
Awesome. Good.
Boom. Bite her knuckle. Yep.
Love it.
All right. So,
Let's go right like that. I'll just speed you up a touch.
Gonna catch
Everybody's
up.
feeling good.
totally. Feeling great.
Yeah.
We had Indian food. One of the things that I learned the hard way too is you want to not do it on an empty stomach.
For sure.
Yep. So definitely eat before you get vitamin therapy, and then
Can
it's
make
just
you feel
super easy.
nauseated. It's
Yeah.
not like dangerous.
No, not dangerous,
But
yeah.
yeah.
Right. Yeah, you can get lightheaded, kind of like flushes of heat. if it's dripping too fast, if you haven't eaten, or if there's too much magnesium in the bag. But the doc is responsible for that part. So most people feel really good, very relaxed. Some people feel more energized. I would say I love when my patients get a nice balance of that relaxed but focused energy, because you've got the B vitamins, you've got the magnesium, so that gives you that little boost. And then if you're doing like the hangover IV, then
Right? They have it in Las Vegas. They come to your hotel.
And just hook you up.
Yeah.
Oh yeah.
I have been in Dave Asprey's hotel room, I must say.
Okay. Dave Asprey has every goodie you can imagine. Like, that's how he rolls.
Yeah. But for those, we add extra B1 to help support the alcohol metabolism pathway. And then we might do a little extra glutathione just to clear out whatever we can from the night
Toxins.
before.
Like a karma clearer.
Yeah. Glutathione now clears karma. That's
Totally. You heard it on the health bridge.
You heard it here first from the Urban Monk.
If I would have known it was so easy.
Right?
Yeah, no kidding.
There you go.
So also the vitamins and the actual therapies here, you want to work with someone who knows what they're doing. Where can you find practitioners to do this? Like, I'm lucky, I got both these lovely ladies around me, and so we're actually working an arrangement to have them both round through my Southern California clinic, just because selfishly I want them around. So I want to get one of these like a week. But like, where does someone find a practitioner to do this?
So there's NDs can do it, so naturopathic doctors like myself. MDs can do it, and it's really being trained in the therapy.
And some chiropractors.
Really?
Yeah.
In some states?
Yeah.
Okay.
Oh, interesting.
Yeah, I didn't know that. Good to know. So finding out, there's the drip bars there. I recommend actually seeing a doctor and having labs done before you actually start getting your drips, just because it's the standard of care. You're finding out, how much can your system handle? What are your nutrient deficiencies? It's really just the best way to do it. But the drip bars are fun too, just for hangovers
And these are water soluble.
Right. So it's really, if you're just going to pee it out if you overdo it. And
Yeah, waste of money.
Yeah.
If you don't need it.
Expensive pee.
Yeah.
And there is a benefit to getting some of those nutrients up super high, like the vitamin C. We can do very high doses that you wouldn't even be able to take in orally. Like it would just be impossible.
Like 100,000
like
milligrams.
like
kind of thing.
50 grams.
Yeah, 50 grams.
Yeah. We use that more when we want a pro-oxidant effect, like when we're working with cancer patients. That would be
And viral loads.
high viral loads.
HIV.
Absolutely.
Yeah.
I've been looking at all sorts of crazy stuff. Tammy and I are looking at some technology now where they run this kind of thing, run your blood through a UV light and all sorts of things. And so there's a lot of stuff out there. It's hard to know how much of it is anecdotal, how much of it is like evidence-based. I mean, this is simple math, right? Like, we're putting vitamins your body needs into your body, right?
And minerals.
And minerals,
Yes.
right, sure, which is a big thing, actually.
Yeah.
Right? Like, most people are mineral deficient,
Yep.
and they don't think about it because you just assume it's in your food.
Right, and we're usually more mineral deficient than we are vitamin deficient. And you want to make sure your ratios are right. So minerals are very important. Don't forget those minerals.
You know what I find interesting is I love biochemistry. I think I'm like a closet nerd or something. But when you look at the vitamin C pathway and see the collagen, but then when you look at vitamin C and glutathione, it also inhibits the production of your melanin. So this actually has been proven in studies to decrease melasma. And so you do consecutive skin brightening IVs, which is vitamin C and glutathione, and those really dark patches that women get when they're pregnant, or people of Asian descent or Indian descent are more prone to it. It actually lightens it, and it's because of the inhibition of glutathione on the production of melasma.
Wow.
Of the melanin, I mean.
Yeah, melanin.
Yeah.
Wow.
Yeah, I've seen some
And
really
melasma.
beautiful vitamin C glutathione, like skin brightening
Skin
or
brightening.
like radiance IVs.
Yeah, we do them, and it's pretty shocking how well it works. And that wasn't the initial, thought, but turned out, a lot of medicine is by accident.
Right.
You're like, oh, wait a minute.
Right. Well, what's interesting is, and I'm going to cross over real quick and talk about chelation, because we're talking about minerals, and I know a lot of docs do chelation where they'll try to chelate out heavy metals,
Right.
Which is kind of different math, obviously.
Very different.
So right now we're putting in the minerals that the body needs and is deficient in, but there are things in the body that our body probably shouldn't have on board, like lead, like mercury and all that. And so there's also treatments where you can run certain elements or agents through the body that will grab those and pull them out.
Absolutely.
Yeah, and so I don't know if naturopaths do that.
Some do. It takes a little more specialized training.
Yeah.
And with the chelation, you definitely want to make sure you're repleting in between. You want to make sure you're running all of your labs to make sure your kidneys can handle the elements that are coming out. It's very supervised, and people can see amazing results. It just has to be done very carefully.
Yeah.
Yeah.
Well, and the agents that are used, we do that at our clinic. It's the exact same stuff that we used, years ago in New York when the kids were coming in from chewing on the lead paint. They'd have lead poisoning. It's the exact same treatment, only it's a little bit more, preventative and a little bit more proactive than these poor kids that had lead poisoning.
Shoot on lead. So you do this in your Seattle clinic?
We do. We
Great.
do heavy metal chelation, we do IV therapy, and we do it customized based on what people need.
Great.
But it's fun, isn't it?
Oh, it's very fun.
Yeah, because it's easy.
Yeah.
There's a big lazy boy chair, and people just sit back.
Chat.
Yeah, this is actually kind of unconventional because we're obviously on a set and there's like cameras
Right.
and lights and stuff.
Yeah.
But like, traditionally when you do this kind of therapy, you're in lazy boys hanging out with like 5-6 other people,
Yep.
kind of shooting the breeze, doing it. And I love it. We're actually working on one, Tammy, you'll like this. We're working on one for when Dr. Zagoni comes down to our clinic called the Zen Drip, right? And then
I love it. What's in it?
Well, we're
Lot
still
of
working
magnesium.
on it. Yeah. Well, we're still
Some special amino acid blends, perhaps.
Yeah, so we're still working on it. So for anyone who's running these types of things, as soon as we've tested some protocols, we'll share. But we're also doing it with hollow sync type of brainwave meditation tracks.
What a great
Maybe
idea.
yeah, might as well, right? So yeah, it's been quite a trip watching how medicine has evolved from just like crisis care to this kind of weird functional medicine intermediary to now just all of these things that enhance your health. I mean, we like the word vitality.
We do. That's how we met.
That's how we met, right? We both had clinics named Vitality, and I mean a movie named Vitality, and so it was just like, holy crap, who are you? Who are you? And so what is vitality? It's kind of like that energy of life. It's not like the sickness that you deal with, right? It's the cushion that you create, kind of getting out ahead of this stuff.
And
right?
realizing the absence of disease does not equal wellness.
Absolutely.
Absolutely.
And one thing I love about these IVs is that, a lot of people who are pursuing alternative medicine and complementary medicine are busy. They're looking at being able to maintain their high performance life. And so doing this actually gets you the opportunity to sharpen your saw in a very quick fashion. And lots of people say, well, I don't have time to take care of my health. Well,
Totally.
20 minutes, you totally can do something that'll really boost your health and your energy and preventative medicine all at once.
It's a power reset, right?
Definitely. Well, and for those high performance people, I assume they're traveling all over, the country, the world, and that takes a lot out of you, both, oxidative stress, radiation, sleep, all the stuff that's floating through the air while you're on that airplane. Food, absolutely. One of these before, one of these after, we get those antioxidant levels back up, we boost the immune system, and you can maintain that performance even with a heavy schedule of travel.
Yeah. Lord knows we got them. Lord knows we got them.
I just finished my book launch and you're about ready to do it. So yeah, it is.
Yep.
It is.
This is my pre-book launch, like juice up here.
That's a good
Beautiful.
idea.
Yeah, no, it's
Thank you.
I do
This
it
is great.
any occasion I can. So great. So we're actually going to be incorporating some of this with you at our local clinic here in Southern California, and the website's being tweaked right now. We're kind of glued on you. It is Vitality. Yeah, we'll put it there, but it's vitalityhealthcare.com, and so Southern California, and in Seattle, if you're interested.
It's drtammy.com and Vitality Medical Clinics. So we can't do this virtually. We have Skype and phone appointments, but if you're in the Seattle area, we can do this.
Pull in, get some juice.
Yeah.
So Doc, thank you for this. This has been great.
It's my pleasure. Thanks for having me.
Yeah.
Thank you.